A Pap smear is a quick and simple test. It involves collecting cells from the cervix, which is the lower part of the uterus, to check for any abnormalities. The procedure is usually done in a doctor's office and takes only a few minutes. Despite its simplicity, it plays a crucial role in women's health. It can help detect cervical cancer early on. Early detection is vital because it significantly increases the chances of successful treatment. When cervical cancer is caught in its early stages, it is much more manageable and treatable. This is why regular screenings are so important. Cervical cancer affects the cervix, which is the lower part of the uterus. The cervix plays a critical role in the female reproductive system, acting as the passage between the uterus and the vagina. Understanding its location and function helps in appreciating the importance of keeping it healthy. Early detection is key to successful treatment. When abnormal cells are found early, they can be monitored or treated before they turn into cancer. This proactive approach can save lives and prevent more invasive treatments down the line. This is why regular Pap smears are crucial for women's health. Women are advised to start getting Pap smears at the age of 21 and continue at regular intervals as recommended by their healthcare provider. Staying on top of these screenings can make a significant difference in long-term health outcomes. Pap smears help identify abnormal cells in the cervix. These cells, if left unchecked, can develop into cancer over time. By catching them early, doctors can take necessary steps to prevent the progression of the disease. These cells may or may not develop into cancer. Not all abnormal cells are cancerous, but their presence can be a warning sign. Regular monitoring ensures that any changes are caught early and managed appropriately. But a Pap smear can catch them before they become a serious problem. Early intervention can include treatments like removing abnormal cells or other preventative measures. This proactive approach can prevent the need for more aggressive treatments later on. This allows for early intervention and better chances of a positive outcome. When issues are addressed early, the treatments are often less invasive and more effective. This can lead to better overall health and peace of mind for the patient. Getting regular Pap smears offers peace of mind. Knowing that you are taking steps to monitor and protect your health can reduce anxiety and stress. It is a simple yet powerful way to stay proactive about your well-being. It empowers women to take control of their health. Regular screenings are a form of self-care and empowerment. They allow women to stay informed about their health status and make informed decisions about their care. Don't underestimate the importance of this life-saving test. A Pap smear is more than just a routine checkup. It is a critical tool in the fight against cervical cancer. By prioritizing regular screenings, women can take an active role in safeguarding their health and well-being. A Pap smear, also known as a Pap test, is a screening procedure. It checks for cervical cancer. During the test, a small sample of cells is taken from the cervix. The cervix is the opening of the uterus. These cells are then examined under a microscope. This is done to look for any abnormal changes. These changes could indicate the presence of cancer or precancerous cells. The procedure is quick, typically taking only a few minutes. It is performed by a healthcare provider during a pelvic exam. Women should start getting Pap smears at age 21. This is an important step in maintaining your reproductive health and catching any potential issues early. This recommendation applies regardless of their sexual history. Even if you have never been sexually active, it's crucial to begin screening at this age. Women between the ages of 21 and 29 should have a Pap smear every 3 years. This regular screening helps detect any abnormal cells that could develop into cervical cancer. Women aged 30 to 65 have 3 options for screening. These options allow for flexibility based on individual health needs and preferences. The first option is to continue with a Pap smear every 3 years. This method has been the standard for many years and is highly effective. The second option is to have an HPV test every 5 years. The HPV test specifically looks for the virus that can cause cervical cancer. The third option is to have both a Pap smear and an HPV test every 5 years. This combination provides a comprehensive screening approach. HPV stands for human papillomavirus. It is a very common sexually transmitted infection, and most sexually active people will get it at some point in their lives. While HPV often goes away on its own, certain strains can cause cervical cancer if left untreated. Regular screening is essential to catch any changes early. After age 65, Women may be able to stop getting Pap smears. This is typically recommended if they have had regular testing with normal results for the past 10 years. However, it's important to discuss your individual situation with your healthcare provider. They can help determine the best course of action based on your medical history. Talk to your doctor to determine what's right for you. Regular communication with your healthcare provider ensures that you receive the most appropriate care for your needs. You will lie on an examination table. Your feet will be placed in stirrups. Your doctor will gently insert a speculum into your vagina. The speculum helps to widen the vagina so the doctor can see the cervix. The doctor will then use a small brush to collect a sample of cells from the cervix. You might feel slight pressure, but it shouldn't be painful. The cells are smeared onto a slide and sent to a laboratory for analysis. The whole process usually takes less than 5 minutes. It's a quick and straightforward procedure. Knowing what to expect can make the experience less daunting. Pap smears are crucial in preventing cervical cancer. They do this by detecting abnormal cells before they become cancerous. Early detection allows for treatment before cancer develops or spreads. While Pap smears don't prevent cervical cancer entirely, they significantly reduce the risk. When caught early, cervical cancer is highly treatable. Regular Pap smears contribute to a significant decline in cervical cancer deaths. By detecting precancerous cells, Pap smears can prevent cancer from developing. This early intervention is key to saving lives. Regular screening is vital for maintaining your gynecological health. Section 6. Understanding your Pap smear results. After your Pap smear, your doctor will contact you with the results. It's normal to feel anxious while waiting, but most results are normal. A normal Pap smear result means no abnormal cells were found. You can continue your regular screening schedule. An abnormal result means some changes were detected in your cervical cells. Don't panic. Most abnormal results are not cancer. Your doctor might recommend further testing. This could be another Pap smear, a colposcopy, or a biopsy. These tests help to determine the cause of the abnormal cells. Section 7. What happens after your Pap smear? If your Pap smear is normal, you don't need any further tests. Your doctor will advise you on when to schedule your next screening. If your results are abnormal, your doctor will discuss the next steps. This might involve further testing or monitoring. The specific recommendations will depend on the nature of the abnormalities. Further testing can include colposcopy, a procedure to closely examine the cervix, and biopsy, where a small tissue sample is taken for examination. Don't hesitate to ask your doctor any questions you may have. Understanding your results and the follow-up procedures can ease anxiety. Section 8. Frequently asked questions about Pap smears. This section aims to address common concerns and provide clarity on this essential health screening. One of the most common questions is, does a Pap smear hurt? Most women experience little to no discomfort during the procedure. The process is generally quick and straightforward. You may feel slight pressure during the speculum insertion, which is used to gently open the vaginal walls for a clear view of the cervix. Another frequent question is, can I get a Pap smear during my period? It's best to avoid scheduling your Pap smear during your period. Menstrual blood can interfere with the accuracy of the test, making it harder to get clear results. The presence of blood cells can obscure the cervical cells that need to be examined, potentially leading to inconclusive results. How accurate are Pap smears? This is another important question. Pap smears are very accurate in detecting cervical cell changes, which can indicate the presence of precancerous or cancerous conditions. However, no medical test is 100% foolproof. There is always a small chance of false positives or false negatives. What should you do if your Pap smear is abnormal? First and foremost, don't panic. Most abnormalities found in Pap smears are not cancer. They often indicate minor changes in cervical cells that can be monitored or treated. Follow your doctor's recommendations for further testing and monitoring. This may include a follow-up Pap smear, an HPV test, or a more detailed examination called a colposcopy. Remember, regular Pap smears are a crucial part of maintaining your reproductive health. They help in early detection and prevention of cervical cancer. If you have any concerns or questions about Pap smears, don't hesitate to talk to your healthcare provider. They are there to help you understand and navigate your health journey. Stay informed, stay healthy, and take charge of your well-being. Section 9. Don't delay. Schedule your Pap smear today. Pap smears are essential for early detection and prevention of cervical cancer. They are quick, simple, and potentially life-saving. Don't delay. Schedule your Pap smear today. It's a proactive step towards protecting your health. Remember, early detection is key. By staying on top of your screenings, you're taking control of your well-being. Talk to your doctor about any concerns or questions. They are there to guide you and ensure your health is protected.